Hi, I'm Bedrest Coach Darline Turner-Lee, owner and founder of Mamas on Bedrest and Beyond. Today I'm talking about stroke risks and preventions for mamas on Bedrest and beyond. Now, I've talked about stroke in numerous forms and related heart diseases in pregnant women previously, and I will refer you to mamasonbedrest.com to see some of these blog posts and hear some of the podcasts relating to this. But I wanted to come back to this topic right now just because in my own life, just this past week, my mother-in-law had a small mini stroke. And it's been a little stressful because this is actually her second mini stroke in about 3 years. Thankfully, she has no residual this time. She had a little bit of memory and a little left-sided stuff going on after her last stroke, which has mostly resolved, but she feels differently. But this time she really doesn't have anything going on. But I wanted to, it just made me think about, again, that so many people say, oh, well, pregnant women are increased risk for stroke. And it made me go and say, well, what is really the risk? So I did a little checking and found that there is really only a mildly increased risk of a pregnant woman having a stroke versus a non-pregnant woman of the same age and health status. But what is interesting is there is an increased risk of stroke for pregnant women in the immediate postpartum. So those first 6 weeks after you deliver is when you're at the greatest risk for stroke. So, that's the time to really be vigilant and to watch. Now, I put a post on the blog for Mamas on Bedrest and Beyond when a friend of mine had intracranial bleed in the early postpartum, and it was because her blood pressure spiked after she delivered her child. And again, this is when we see this going on. This is where there is the greatest risk in that early postpartum period. Off the top of my head, I don't remember the date, but I do remember that the title was something like pre-eclampsia doesn't necessarily end with delivery. So look for that post at mamasonbedrest.com/blogs. So when I was thinking about this and I wanted to look and see, well, what women would be at increased risk for a stroke if they were pregnant. Now, it's the same as for women who are not pregnant, those with regular stroke risk, those who have high blood pressure, those who have increased lipids, those who have a family history of heart disease. They're going to be at increased risk for stroke anyway, and that mild increase they would also get from pregnancy adds an additional risk. Women who have lupus are at increased risk for a stroke. Women with antiphospholipid antibody syndrome, that's somewhat rare, but if you have that, any women who have blood clotting disorders anyway are at increased risk. Again, women with pre-eclampsia or eclampsia, women with gestational diabetes, and we know those are two very common reasons that women go on bed rest, so we need to be careful. That increases your risk a little bit. Women with sickle cell, again, any type of blood disorder is going to upset your normal milieu and is going to be further upset with pregnancy, putting you at increased risk. Women with thrombotic thrombocytopenia purpura, which is another blood disorder, vasculitis, which is inflammation of blood vessels, Takayasu's disease. I'm not going to get into that here. We'd have to do a whole blog post to explain that. And people who use illicit drugs, which is not a good thing to be doing in pregnancy anyway, which creates a whole body of risks, but one of them being increased stroke. So what is interesting is that there are some specific conditions to postpartum women that actually increase the risk of stroke in that early postpartum period. Now, this was something new for me, and this is something I want to bring up because we actually talked about a couple of these things in previous posts, as I stated, and I will reference them again if you want to go back and check. But choriocarcinoma, which is carcinoma, or a cancer, that is, of the, just had a brain lapse, a cancer in postpartum women. Postpartum angiopathy. Now, again, this is something sort of related to what my friend had who had the intracranial bleed. She not only had the high blood pressure, but they did find she had a little something interesting going on with her blood vessels. So, again, that post was pre-eclampsia does not always end with delivery. And that was a blog post on mamasonbedrest.com. You can find it at mamasonbedrest.com/blog. Then women who have postpartum cardiomyopathy or an enlarged heart. Now remember, we did a podcast with Ms. Brenda Torrigiani, I think is how I say her name, and she has peripartum cardiomyopathy. She developed an enlarged heart while carrying her baby. Now, this is something that's a whole different topic, and it would be great for you to go and listen to that podcast because she gives a really great description of what happened to her and kind of what postpartum cardiomyopathy is. But again, when you have something that's already going on with the heart, the added strain of pregnancy, the thing that's going on with the heart, all puts you at increased risk of a stroke. And then an amniotic fluid embolus. Now, this is when a little bit of amniotic fluid kind of just gets walled off, dislodged, and then embolizes, or i.e. travels to the heart, lungs, brain, and causes stroke. So those are the things that put women who are pregnant and or on bed rest at increased risk. And as you can see, some of it is really, I don't want to say out there, but much more rare. The things that I would say for women who, for the kind of average mainstream woman, even if she is on bed rest, to be concerned about or to keep an eye on are women who have gestational diabetes, watching those blood sugars, and women who have high blood pressure, whether or not it develops into pre-eclampsia. So what can you do? What should you do if you feel like you're at risk or you just want to prevent any type of stroke or keep as minimal as possible your stroke risk? Well, this is what you do. You do the same thing you would do if you weren't pregnant. You want to maintain a healthy weight. Now, of course, you're saying, well, I'm pregnant, I'm gaining weight. Absolutely, you have to gain some weight for pregnancy because that's what pregnancy is. But that does not mean just go off the charts. I had one OB tell me she had a patient once who had gained 109 pounds. I mean, I can't think of a situation other than maybe if you're the octomom where you need to gain that much weight. If you're having a singleton or even twins, that's just excessive. So, talk with your doctor. What's an acceptable weight gain for you? Again, if you're a small person, you may actually need to gain more weight. If you're starting out a little over where you need to be, you may need to gain less. But talk with your doctor and find out what's an acceptable weight for me or acceptable weight gain for me during pregnancy and try to work with that. Secondly, eat a balanced diet. We're always talking about eating healthy, and it seems like with pregnancy you want to eat like everything in sight and stuff that's really not that healthy. You got to go sometimes with the cravings because it will drive you crazy, wake you up in the middle of the night, but that does not mean make a steady diet of it. Yes, have your pickles, yes, have your chips and salsa, yes, have your ice cream or whatever it is, but kind of keep it in line. Make it a treat as opposed to this is what I'm having all through my pregnancy because I'm eating for two. You got to remember when you're pregnant, you only need about another 300 to 500 extra calories daily to gestate this baby. You don't need to just go hog wild. And 300 to 500 calories, that's like half sandwich. It's not really as much as you're thinking. It's a decent sized salad. It's depending on what type you have, it's a protein shake. So, if you think about it, it's really not a lot of extra food that you need to take in. And finally, you need to exercise. Now, this is always controversial. When I'm talking to women on bed rest, they're like, I can't exercise. I'm on bed rest. I can't move up. That's not entirely true. No, you are not to go out and run a marathon. In fact, some of you may not even be able to get up and walk around your house, but that does not mean that you are not to move at all. It is to your benefit to move at least once an hour. And when I say move once an hour, I say take about 10 minutes and stretch. Stretch your arms and legs over your head. Stretch your arms and legs out to the side. Wiggle your toes. Roll your ankles. Hands out and in. Do things like this. You want to get the blood moving. Also, shift positions. Now, a lot of women are saying, well, I was told I have to lay in bed on my left side. That's true, but for 10 minutes, roll around. Roll to one side or the other. Now, again, you have to be careful. If you have high blood pressure, this may spike your blood pressure. So you need to take your blood pressure before you move, take your blood pressure right after, and you will learn what things you can do. But for you to go from a position on your side where you may have your knees drawn in to just completely elongating your body, that may be enough for you to do. I have set up a whole kind of protocol of exercises for women on bed rest to do that are simple, they're effective, they are very non-stressing to the body, and they come with the Bed Rest Success Kit. And if you go to www.mamasonbedrest.com, sign up for our newsletter, you get this, you get the kit, you get the exercises. So you know, they're all laid out for you. They're very easy to do. Also, if you have more liberty to do a little bit more, then you may want to pick up Bedrest Fitness, which is the DVD we've developed for women on bed rest. And, you know, while a lot of women are like, well, I couldn't do the sitting up things, I couldn't do some of the other things, you can do the arm exercises. Because even if you move your arms, that starts getting blood circulating. If you have high blood pressure, you may not want to have your arms up here, but it's very much okay to have them here and move them back and forth using the band. Always check in with your physician or midwife before you start any exercise program, but you do have to move, even if it's no more than you roll over on one side and roll over onto the other every hour. Whether you stretch your legs straight out and you bring them in, you have to move, because you have to remember, if you're just laying there bent up, your blood vessels, especially around the hips, it's like a garden hose. And I'll show you here with one of the cords for like my iPod here. You know, here's your normal blood vessel. Well, if you're pregnant and you're laying in bed, it may be getting kinked like this, and then you add the weight of the uterus on it, might be getting a little compressed. So you're getting the kink here like this because you're laying in bed bent, and then the added weight of the uterus. And you don't want to be doing that. So periodically stretch out, give a little stretch your legs, wiggle your fingers and toes, and you're pretty good. Finally, and almost more importantly, know the signs and symptoms of a stroke. Strokes happen very acutely. They happen at a drop of a hat. All of a sudden things are fine and then they're not. Most people say it starts with just sudden onset of raging headache, the worst they've ever had. It's just blaring, sometimes on one side, sometimes on both, sometimes in the back of the head, and that is often indicative of where the stroke is occurring. You often will become suddenly confused. You don't know where you are. You're disoriented. You might not be able to see. You may have blurred vision, double vision, or sometimes you may not be able to see out of one eye. Suddenly one eye goes black. Dizziness, trouble walking. Now this might be a little harder for a woman on bed rest, but if you go, because you're not up, but if you go to stand up and you just don't have it, and you have to discern whether that's just, gee, I've been laying in bed, versus, whoa, my legs are not working, you know, that's what you have to do. But in any event, if you have any question, any doubt, you call your obstetrician or midwife right away and you interrupt them. You make sure you get someone on the phone. Don't go through the whole thing like, well, I left a message, no one answered. No, you stay on that phone until you get a person. Interestingly, some women get, some people, and I'm saying women because I'm talking to women, but they get nauseous or they start vomiting. And especially in pregnancy, you might be thinking, oh, well, it's the pregnancy, or, you know, but if it's sudden onset and you were feeling fine and then all of a sudden, boom, you're throwing up, you know, if nothing else, call your obstetrician or midwife. Again, make sure you get a person and not a person who's, well, I'll take a message and have someone get back to you. No, you need to speak to a person right then. Don't let them blow you off, and make sure it's a nurse or your obstetrician and say, look, I was doing XYZ thing, I was feeling fine, and then this. Because they may want you to come in, because if you are having a stroke, there is a really narrow window of time where they can administer certain treatments and kind of reverse things and make sure that you're going to be okay with no residuals. I just had a thought of something I was going to tell you and I forgot. But hey, that's how we do. In any event, those are the major points I wanted to cover. Also, coming back to thinking about my friend's case, if you do have pre-eclampsia and if you do have like high blood pressure spikes after delivery and you're sent home, take your blood pressure, measure your blood pressure. High blood pressure is a very strong indicator of an impending stroke. If it changes, if suddenly if you're fine and then suddenly your blood pressure goes up, that means something's going on. You may not have a stroke, but in any event, it's something to be concerned about and something to report to your doctor. The little handheld home Blood pressure kits, they're very inexpensive now. You can get them at any local pharmacy. I think you can even get them at Walmart or something. But if you have high blood pressure, it's something good to have around. You can do the wrist ones. You can get the ones you just put your arm in, press a button, it takes your blood pressure. But know what's going on. So that's all I have for you today. It seems like, I'm kind of beating you over the head with the stroke thing, but it came up again. I was thinking about my mother-in-law, and I was just thinking about the risks for women, and I just wanted to make sure that you're safe, that you're healthy, and that you get through this bed rest thing as best possible and have a wonderful, happy, healthy, safe labor, delivery, and beautiful little baby. So that's it for me, Darline Turner-Lee, Bedrest Coach, owner and founder of Mamas on Bedrest and Beyond. If you have more questions, please visit my website, www.mamasonbedrest.com. Check out our blog section. Check out the podcast. We have all kinds of information. We have resources. And if you have questions specific to your situation, sign up for a complimentary bed rest breakthrough session. It's 30 minutes. We just focus on you and what's going on. Just send me an email, info@mamasonbedrest.com, and we'll get you taken care of. Again, Darline Turner-Lee, Bedrest Coach, owner and founder of Mamas on Bedrest and Beyond. Thanks so much.